I've never learned how to relax. I have never learned how to really enjoy doing something other than family, work. That's about it. So it's a problem. You need an outlet. You need something to get excited about. And I haven't done that.
Many people who are sort of living on a treadmill of achievement, if they don't take any time to step off the treadmill once in a while, that sooner or later it catches up with them and their body begins to protest.
Welcome to The Story Behind the Symptoms, a podcast from Symptomatic.me. Your host is David Clark, MD, a board-certified gastroenterologist who successfully diagnosed and treated over 7,000 patients with neuroplastic pain or illness. Each episode, we dive into our guests' life experiences to uncover the deeper causes of their symptoms. By listening to their story, you will gain insights that advance your own journey towards knowledge that becomes healing.
Hello, and welcome to the Story Behind the Symptoms podcast. I am your host, Dr. David Clark, president of the Association for the Treatment of Neuroplastic Symptoms. And what we do in this podcast is talk to people about their symptoms and the progress that they've made over time. A little bit unusual today. My guest is Johnny, who is still actively battling his symptoms, and I'm going to have him introduce himself.
Well, thank you. I was doing pretty well until about 2.5 years ago, and I had foot surgery. But prior to that, in 2000, someone decided to run a red light and T-bone me. And from 2001 to 2020, I had 23 different operations. So I think when I had my foot operated on 2.5 years ago, I'm not sure CRPS started because of that or because it was simply an accumulation of all the different operations that I've had.
All right, so CRPS is complex regional pain syndrome. Want to explain that for our viewers?
Okay. I had metatarsal ischia. I woke up one day and the bottom of my foot was just on fire. I couldn't stand. I couldn't walk. I finally made it to a podiatrist who sent me to a surgeon. They decided to operate, which they did in January. The swelling after the operation never went down. The color of my foot stayed bright red and cold. And so a few months later, after suffering for a while, I went to another surgeon who decided he could fix it. Well, that was a second mistake because he couldn't and he didn't. And the pain has increased substantially. I'm usually living at an 8 or a 9 on the McGill scale. The disease has spread from my left foot to my right, so both feet have it. The left is much worse, but both feet do have it. It's difficult to walk. Maybe I can walk 20 feet without having to stop because of the pain, rest, and then I can go a little bit further. It's a disease that certainly has affected my quality of life. I have 2 very young grandchildren that live literally next door to me, and they want to play soccer, and they want to run, and they want to do all sorts of good things. I can't do it. So it's pretty painful physically, and it's very painful emotionally. And it's now been over 2 years, I guess, since I've really had the CRPS. I ended up going to the Special Surgical Hospital of New York City to try to get diagnosed. That was great because I went, but it was so late, 2.5 years later. And in 10 minutes, they diagnosed me with complex regional pain syndrome. I said, what do I do? They said, you go back to where you live, Washington, D.C., and get the absolute best pain management doctor you can find and hope. And that's what they told me. So here I am, 2.5 years later. I'm struggling. I'm reading everything I can read. I'm on the internet constantly in forums and so forth, and with the association that Dr. Clark's with. And I'm meeting really fascinating people, many who have struggles just like myself. Some have actually had remission, which is very hopeful for me. And some are managing their pain. They caught the disease early, and certain treatments have helped. I've had just about every treatment you can think of, from wires in my back to shots to ketamine to physical therapy twice a week for the past 16 months, I believe. So I'm trying to do everything I can to alleviate or at least decrease the pain level.
I have a couple of questions. First of all, there was a break in the feed when you were telling us what the New York surgeons told you. They said to go back to Washington, D.C. and do something there.
Yeah, hope.
Hope.
Yeah, they had absolutely no idea what to do. They did know about the CRPS, which is better than my doctors here, who obviously missed the diagnosis. But one of the things they said in New York was that I didn't catch it early. And if you don't catch it early, it's much more difficult to deal with the pain and all the different things that we can try. They said they may not be effective, and unfortunately, I wish they hadn't even said that, but all the treatments I have not been effective.
Okay. All right. Good. You mentioned metatarsalgia. The metatarsal are the bones in the foot that correspond to these bones here in the hand, and the algia part means that they're painful. Was that thought to be connected with the motor vehicle accident, or just came out of the blue?
Just came out of the blue. Yeah, nobody connected it at the time. And I think it did just come out of the blue. I didn't have any operations from my knees down. Most of my operations were 7 in one hand and 3 in each shoulder and a hip replacement, things like that.
Okay. All right. And tell me again what year the metatarsalgia started.
November of 23.
And then the CRPS began fairly soon after that.
Well, January was the operation, and after that operation is when it began. So January of 24.
24. All right. So we are recording this in February of 26. So you've had this for about 2 years.
Correct. That's about right. Yeah.
All right. So the potential explanation that we're going to explore is whether this could be for you a neuroplastic condition. We don't have proof for that. The proof would be if we uncovered some issues that we could do something about, and then we treat those, and then we see that your CRPS begins to respond and to improve. And it can be a pretty wide-ranging discussion. And, the place to start is whether there was anything unusual or stressful in your life going on around the time the metatarsalgia, which literally kicked all this off, began.
I think the answer is probably yes. There was a lot of stress going on. I didn't want to move to D.C. We lived in Kansas City for 40 years, very comfortable there with a lot of great friends. I asked my wife if they stopped using the airplanes anymore because I really just felt we should stay in Kansas City and fly to D.C. whenever we wanted to. And she said, no, we're not going to do that. And since I've known my wife since we were 4 and we dated all through high school, college, and so forth, she has me trained pretty well. When she says to do something, I just do it. So we packed up and moved to D.C. And it was a very traumatic move for me, very stressful. Coming from where, again, I knew everything and everybody and had all these friends to where I really, other than family, knew no one. This expensive D.C. area is double what Kansas City is. Kansas City is extremely affordable. So the short answer is yes. It was a very stressful period for me.
Okay. All right. Did you have any other symptoms elsewhere in your body other than those connected to the motor vehicle accident? Okay. Because a lot of people with neuroplastic symptoms have more than one symptom. Not everybody. The average is about 3, a little fewer for men, a little more for women, but certainly not unusual to have only one symptom. All right. On this program, we frequently talk about what things were like for people when they were growing up, because that can have long-term impacts, even in people who have gone quite a long way in their life. Speaking of which, what year were you born?
1949.
And did anything happen to you as a kid that you would really not want your grandchildren to experience?
I'm your perfect guest. The answer is yes.
Okay. Let's explore that.
I lived in a home with constant fighting, constant berating everyone, parents tearing each other down, parents tearing grandparents down. It was an incredibly negative household. My parents split up 5, 6, 7 times, as I remember. It was not unusual for me to come home and find my father moved out, but somehow, some way, they always got back together. It was a very stressful home always, from the time I was little to the time I finally left to go to college.
Okay. And what sort of impact do you think that might have had on you as an adult? Did you, after you went off to college, did you just leave everything behind? Or do you think that there were impacts on you in any way?
I don't think I've left much behind at all. I mean, I'm 76 and it still haunts me, the way I was raised. I think the impact has been significant forever. It was a very tough way to grow up. My mother became an alcoholic, and I had an older brother who committed suicide when he was 27 and I was 25. So we had a lot of trauma between just the parents, and then with my brother's suicide, it's been very, very difficult, very tough for me. I consciously try to be different with my grandchildren and children and wife than what I saw growing up. I'm very conscious of it. It's a big effort that I take to be unlike my father or my mother. But it was very stressful, and I have not escaped it yet.
And what role did you play in the family when you were growing up? Did you try to avoid what was going on? Did you try to be the peacemaker? What was your response?
My father was extremely frightening. He would get angry very easily, especially took his anger out on my older brother. Not so much for some reason on me, but I remember my brother getting slapped with a belt and me running and jumping on my bed and facing the wall and just terrified, not that I'm next, just horrified by what was going on. So I was the second out of the first two. My parents, for some reason, 11 years later, my mother gave birth to another child. And she said, kids are like dogs. They can't be alone. So I'm going to have another one. So she had another one. So there were 2 and 2 with a big separation of 11 years. So I'm not close to my younger brothers, which is understandable. And my older brother, I was very close to. And as I said, he took his own life. So all these different things, I think, are still wearing on me, to say the least.
Okay. Through the course of living, all of us have times when we're angry about something, but you had clear reasons to try to avoid that. What were those experiences like for you?
I think I was very angry, but I wasn't able or allowed to express it. I didn't take it out on anybody. I had wonderful friends. I think I just kept it inside. I think I just really kept it. It never really came out.
Did you ever have, a sudden outburst that you can remember or become violent with anyone at any time?
No, I probably had an outburst. I never have become violent at any time. I probably screamed at somebody, but, I don't remember who.
Okay. Another way that some people deal with this is by trying to self-treat with one or more forms of addiction, which might be alcohol, drugs, or behavioral addictions like gambling, work, exercise, sex, shopping. I've seen any of those kinds of things that you use to sort of self-treat emotions that might have been inside.
I think for years I used exercise. I ran every day, probably about 3 miles. 7 days a week, I ran in all kinds of weather. I was obsessed with making sure that I exercise. I lost a lot of weight. That's probably my obsession as a younger person.
Okay.
And until this disease, I was walking 3 to 5 miles a day. Kind of that was part of my obsession and addiction coming back again.
All right. What was the timing? My questions typically jump around, so
Sure.
don't be put off. What was the timing of your move to DC?
It was April of 19, and a few months later, COVID hit.
Yeah. Yeah.
So that was compounding my depression and my anxiety, and of course limited my ability to meet new people and to expand some friendships. So it was the next year and a half was pretty tough.
Okay. Did you have depression and anxiety before you moved?
Yeah, I've had depression throughout my life at different times. I'm an overachiever, to say the least, and I obsessed too much with achieving, with being successful. It was very important to me. I never was successful as a student in high school. My brother was straight A's. I was straight C's. I got a B once. They took me to dinner. That was really cool. Big celebration.
Okay. Were there costs to the overachievement?
Yeah, there were. I spent a lot of time away from my family. I had two children. And, I traveled a lot. As an entrepreneur, your business takes up 24/7. You never stop thinking about it. I've started 6 different companies, and they're tough. And many entrepreneurship fade away because it's just too difficult. And I don't think there's anything more stressful than running your own business, starting it and running it. And I did that for years.
Noticed that even in the nonprofit world, I have to say.
That's right. It's true.
And do you think your children suffered from your being away?
Part of me says, I hope so. I hope they miss me. My wife was very nurturing. She's a therapist herself. She did an incredible job with my kids. So I'm sure they missed me, but they had a really strong person at home to help them. And they got to see a good side of me too, that, I was working hard. I taught them the value. At least things don't just come to you. You've got to go earn them, and you do have to work hard. So they saw some good about what I was doing.
Okay. Some of the other consequences of a challenging childhood experience can be other personality traits besides a focus on achievement. These can be things like perfectionism, where nothing you ever do is quite good enough, or people pleasing, where you are constantly focused on the needs of other people in your life, but you're failing to put yourself on the list of people you take care of. Do those resonate for you at all?
I'm your perfect guest. Yes.
Okay.
I think one thing really important I am missing and certainly missed was the lack of praise and acceptance from my parents. Okay, I was never good enough, ever. My brother was a straight A student. I wasn't. He was in some ways, a better athlete than I was. I had a tough road to follow, but I don't think they even accepted him and his achievements. So I have always sought an attaboy from somebody. Okay. And I think that's why I was obsessed with working as hard as I did. I am definitely a lose-win person. I would rather have you happy than myself be happy. And I know that's not particularly healthy, but that's who I am. I walk into a room, I'm the guy that gets everybody excited, gets everybody laughing, gets everybody having fun. But more importantly, I need to do that. I don't want to see someone not happy, not having fun with me. It's really important for me to please the other person. So, yeah, it definitely fits the bill.
Okay. Well, no, those are all very important insights and contribute to a person's stress level. Another trait that I see very commonly in people from challenging childhood environments is that they don't take enough opportunities for their own joy. They never really learned how to just do carefree play like most kids, like hopefully your grandchildren are doing. And so as adults, the idea of taking time out to do something that has no purpose but your own joy is just a foreign concept, and people tend not to do it. And I wouldn't count the running, because that's more of a, certainly that's a time to get away from your responsibilities and clear your head, but it's also quite goal-oriented in terms of losing weight and getting into shape, and it doesn't quite, for me, fit the bill of being something that you do for unrestrained joy. So did you take time out for those kinds of activities, or was that more on the back burner?
Definitely on the back burner. Every therapist I've ever had has urged me to find a hobby, that it would be really important to have a hobby. So at various times I've had a couple hobbies like collecting baseball cards or something like that. No, I've never learned how to relax. I have never learned how to really enjoy doing something other than family, work. That's about it. So it's a problem. You need an outlet. You need something to get excited about. And I haven't done that.
Yeah, I've found that to be true, that many people who are sort of living on a treadmill of achievement, if they don't take any time to step off the treadmill once in a while, that sooner or later it catches up with them and their body begins to protest. Sometimes in the form of fatigue, sometimes in the form of pain, sometimes in a non-pain symptom, but sooner or later, the mind expresses its distress over the lack of joy, and it does it through the body as its only way to communicate the distress.
Mm-hmm.
I also want to point out the idea that you mentioned. It's very important, of nothing you do ever being quite good enough. It took me a long time early in my career to appreciate just how impactful that is. I think most people are aware that if you come from an environment of abuse or violence or substance abuse by one of the parents, I think most people, whether they're a therapist or not, can recognize the trauma of that environment. More subtle things, such as nothing you do ever being good enough, or if it is good enough, the bar of achievement just gets raised.
Yeah.
And you have to jump even higher the next time. That, in my experience, has been every bit as traumatic for people in the long term as the more obvious kinds of trauma.
I think it's dominated my life at times. It's really been important to be appreciated, have that, what I said, that attaboy. And I've looked for it from my parents, and certainly I never got that, which was more important than anything else. I look for that from my wife. I look for that from friends. It's a huge problem. You're never good enough. It's very, very difficult. and I've lived with that all my life.
Yeah, and your own needs and your emotions get shoved down into some unretrievable location.
Too many times, it's true.
All right, another long-term impact is what I call triggers, and these are people, situations, or events that are highly stressful for a person because they are in some way connected to the past. That they're much more stressful for you than they would be for somebody else just because they have these deep connections to the way you were treated in the past. Have you encountered any triggers like that you can recall that really stand out?
I get very upset when I see parents mistreating their children. It reminds me of my father and my mother, I guess, to some extent. I get upset when parents won't talk with their children. I'd also taught middle school, and I worked a lot with parents and saw a lot of problems with parents that basically didn't care. And I saw my problems as a youth reoccurring. So I get very upset when I'm out and I see parents mistreating their children. So that reminds me of what I went through.
Yeah, and I can relate to that in the fact that I've heard so many stories from my patients of experiences they had that were negative for them. And when I observe it in public, I can imagine the long-term consequences very easily. So I have to ask about your own grandchildren. I'm hoping that is not what they are going through, because that would obviously be very tough for you to observe.
I don't agree with everything my daughter and her husband do with their children, and I don't think any grandparent ever does. I would say no, I don't see that happening. They're good parents. The kids are at a tough age, though, 2 and 4.5. And so the 4.5-year-old especially is trying to make his own way and find out what the rules really are. And he pushes everything to the edge. Exactly. Okay. The 2-year-old's starting to emulate that. So he's starting to push it to the edge too. So it's
Well,
just
yeah, the 2-year-old's favorite word is no, of course.
absolutely. And the 4-year-old's is why? Why? So I also have a 17-year-old and a 13-year-old grandchildren from my son. And no, they were treated phenomenally. I think they did a great job. And no, I think my children saw through me the problems that I had growing up. I shared some of them. They knew my their grandparents. So I think it filtered down in a positive way. They saw the negative and turned it into a positive.
That's a great outcome.
Yeah.
Something else that I can just ask about that I've observed sometimes is that sometimes problematic parents can end up being pretty decent grandparents, which actually can be infuriating to observe. Did you happen to see that in your own family?
I didn't. It's funny. I didn't see it so much with my children and their grandparents. I saw it with my parents and the second set of children. It was 11 years later. And so my parents were in their 40s and 50s, and they treated them like grandchildren. I remember coming over, opening up some closet, and baseball gloves, multiple baseball gloves fell out. I'm thinking, I had one baseball glove, and when it wore out, I finally got another one. And they were spoiled rotten. So, yeah, my parents definitely changed with the next two. And you got to admit, it bothered me.
Yeah, the words "what the hell" come to mind.
Yeah, like where was I when when this wasn't happening? So that was tough. That was tough. They got everything they wanted. They were spoiled rotten, and they were treated like grandparents.
And reinforces the idea of you not being good enough.
Absolutely, absolutely.
Very, very difficult. I mean, certainly you got mixed feelings. I mean, you're happy for them that they're not having to go through the same thing. Again, just the question is hanging in the air, why didn't you do this 11 years ago?
Exactly. And it really did, the more I think about it, it really did hurt. It was
no question.
It just seemed like it was so simple to do for us what they did for them. And not to that extreme. I don't need 20 baseball gloves, but my father, this was horrible. We were brought up where there were 3 answers to any question. Yes, sir, no excuse, sir. And I'll never forget one time my older brother, we were in high school, came in and it was 20 minutes past curfew. And my father came running out screaming. And remember, there's only 3 answers. Yes, sir, no excuse, sir. He said, why are you late? My brother held up his hands and they were caked in mud. He had a flat tire. And my father said, then you should have planned to leave wherever you were 20 or 30 minutes earlier in case you had a flat tire. And my brother said something, and he didn't eat for 3 weeks because my father smacked him and broke his jaw. So that's the atmosphere that we had. It was yes, sir, no excuse, sir. And that wasn't true with my younger brothers, to say the least.
Yeah. And, that's clearly that story is so telling that you're living under a standard that no human being could possibly meet. And that you're also living in the moral equivalent of a minefield where at any particular moment something could blow up. That one day you're walking through the field and everything's fine, and then the next day you're walking through the same field and something horrible happens and your jaw gets broken. And that means that you have to be constantly vigilant.
And I was, and I am still. I'm so conscious of what I say, how I say it, to whom I say it when it comes to my children and my grandchildren. I just don't want to be like my parents. I think it's so important that I not be.
And that brings us to one of the big topics for today, which is the emotions, which is one of the most important long-term consequences of adverse childhood experiences, that the negative emotions have to be repressed. You have to learn how to take those and stuff them somewhere, because if you didn't, there were going to be severe consequences in the environment you grew up in. So anger, fear, shame, grief, guilt, all have to be stuffed somewhere and not given a chance to express themselves, even when it's appropriate. And when you do that, you are missing a key signal from the world about your place in the world and your interactions in the world and what's going on and how it's affecting you. The emotions tell us a lot about all of those things. And if we are missing that signal, it makes it very much more difficult to manage our lives in a way that's beneficial for us. And for many of my patients, you ask them how they feel about something, and it's like they really struggle to put it into words. Have you had that sense about yourself?
No, I'm a very verbal person, and I'm able to take these emotions and express them primarily to myself. I'm not letting them out. Certainly as a child, I wasn't allowed to let them out.
Right.
All my life and through all the therapists that I've had, the childhood trauma is still there. It's dramatic. It's impactful. Never receiving your parents' approval, I don't think there's a replacement for that. And my parents have passed away. I can't get it back. There's no way I can get it. And I can look for it in my wife. I can look for it in my friends, but it's different. It's not your parent. So even if I get some attaboys, and I've had my 15 minutes of fame and all that on CNN and great stuff, it's not good enough. Nothing is good enough. Nothing will satisfy me in that attaboy situation. It had to come from my parents, and I can't get it. And I wrestle with that a lot.
Yeah. Well, there are some ways to work around that we'll get to in a bit. But I wanted to ask, from all the reading you've done about neuroplastic symptoms and all the therapy that you've had, have there been any ideas that have stood out for you as particularly useful?
Well, there's many. Unfortunately, I haven't been able to adapt or adopt many of the ideas that I'm reading about. I really do believe in the brain being neuroplastic. I think I had something called neurofeedback, not biofeedback, neurofeedback, and it actually helped. And they really changed the pathways of some of my brain waves and so forth. So I believe strongly in that. I think there's an awful lot to the concept of this is no longer a physical issue. There's no injury causing this pain. I love the example of if you broke your arm, 6 weeks later, your cast comes off, you don't have pain, okay? I had 2 operations. I have lots of pain. So there's something obviously wrong. So I'm really getting into the concept of neuroplasticity and PRT, pain reprocessing type therapy. It sounds great. It makes sense. It resonates. And now I'm trying to work on adopting it.
No, that's exactly the right thing to be doing. Another idea that has helped many of my patients is to imagine a child that they care about, such as your young grandchildren, imagining them growing up in the same household that you did, and you are a butterfly on the wall of that household, watching those grandchildren try to cope with that environment for, let's just say, a week or so. And you are not able to intervene. You are only able to observe. And you are just having to watch them try to cope. And this obviously is not a happy exercise, but the value of it is that it can give you a much better, more accurate sense of how much you went through. Because when you're thinking about yourself going through it, you've got all of your adult years kind of intervening between your childhood experience and today. But if you're watching those two young grandchildren try to cope, then it's kind of naked and raw. You can see more accurately what it must have been like when you were that age. And the purpose of doing that is not to make people upset. It's to help you recognize that that was a remarkable thing that you did. The analogy that I often make is that my patients were parachuted into a dangerous jungle or into the Himalayan mountains as toddlers and somehow had to find their way out of that situation. And that they absolutely deserve tremendous credit for having done that. And that, yeah, they didn't get any pats on the back when they were growing up, quite the opposite. But you can give yourself, for the heroic perseverance that was needed to come through that, not just for a week, but essentially in round numbers for close to 1,000 weeks. It would be tough for you to watch maybe impossible for you to watch your grandchildren deal with that for 7 days. And you had to deal with it for a heck of a lot longer than that. And so you can absolutely internalize some real credit, legitimate credit for having accomplished that. And that can help bring the emotional intensity down to a certain degree. It can help support the idea of taking time for your own joy. The more you recognize internally your own quality and strength, the more you can say, well, you know what? On a regular basis, I deserve to just get out of the house, tell everybody else to go take a hike, and I'm going to do some exploration, some trial and error to find something that has no purpose but my own joy, because every human being needs that. It is an essential human skill. And I think that if you're able to find something like that, and it may take you months and you may feel guilty while you're doing it, but if you've got that underlying credit for surviving the Amazon as a kid, then it'll be easier to come up with an activity that you love to do, and that will help your feet. But the bigger thing is that when you have that internal sense of yourself, it makes it easier to feel the emotions. And so does imagining your grandkids growing up in that environment, that you can feel for them what you might not have been able to fully feel for yourself. And the more you can connect with those emotions, the more you'll be able to put them into words, and not just to yourself, but to other people. Because yes, it's good to be able to feel the emotions. I mean, that's really strong that you were able to do that. Not easy to do that. Most of my patients were not capable of feeling their own emotions. So the fact that you were able to do that is another aspect of how strong you were in coping with this. But being able to express them to other people is also really important. And both of those things, the taking time for your own joy and being able to feel and express emotions towards others, are going to be key foundations for making progress. But I think the third and probably the biggest area is that I think there's a part of you that has a lot more emotion about the move to DC, and that it's not finding any way out. To me, there's a certain amount of meaning in the fact that you're wearing a Washington sweatshirt and a Kansas City hat.
Usually I match them up pretty well. I don't know what I'm doing today.
I think it's because you knew you were talking to me, and your brain wanted to express that the conflict that in between the Washington and the Kansas City is your brain.
Right. That's interesting. No, the move to Washington is it's a problem. I went for my first trip in 2 years back to Kansas City last weekend. I never felt so relaxed in my life, welcomed by so many people that I've been friends with for so long. It made coming back very difficult, very tough. And I want to go back to Kansas City sooner versus later. But I also know I have to cope with this, adapt to whatever it is. But it's been tough. It's been a really tough move.
Yeah.
I didn't want to make it.
Yeah. And I think that, somebody who is so focused on the approval of others that for this particular thing, you've had to really take your feelings and truly stuff them. And they may be coming out in your feet.
Okay.
And that, I don't have a solution to that. I mean, the solution is going to grow organically out of better appreciation for the strength of the emotions you have around this. But you've gotten so skilled at taking emotions, especially ones that are going to be upsetting for other people, and putting them far away. And this one refuses to go away.
True.
The Washington thing it's still a huge problem. Let me put it that way. And
It is.
Solution needs to be found for your feet to get better.
Well, I think I'm going to need to spend more time in Kansas City, split my time maybe between the two. That may help. Well, I know it'll help, just being back in Kansas City.
Yeah, I think so too.
I think that's the immediate solution. And it'd be interesting to see how my feet react to that. I would assume it's going to be a positive reaction.
I think that it will, and it's going to take some trial and error, so I would be open to that, but I would definitely be open to the idea that there are much more powerful emotions going on than you've allowed yourself to experience up to now. Because, you're somebody that tries to please everybody. And this is one that you can't please everybody and lose the emotions around it. So it's an impasse. It's a rock and a hard place. And the only way out of the hard place is for the emotions to be given free rein, so that you can start from a place of honest connection to how you're feeling about this.
Makes sense. I understand. Yeah.
I mean, it's all connected to your early life experience and what you had to do to survive that environment. Now there's, a certain amount of oppression is probably too strong a word, but definitely a challenge to your system. And this time, being 76 years old, there's a part of you that is saying, I don't want to put my own feelings away around this.
Yeah, that's true. I don't. This has been very difficult. I'm sure it's been more difficult than I even know consciously. But I think, as I said, spending some more time in a place where I'm comfortable and warm and it's received warmly can only help. It certainly can't hurt. So I think that's the plan, to try to start spending more time in Kansas City.
Yeah, I mean, you grew up in an environment that was something of an emotional desert, and now you've moved to one.
Yeah, it's amazing.
Apart from the people next door.
Yeah, that's kind of ironic, And I've also always wondered, somehow I made it and my older brother didn't. He committed suicide. So
Right.
I still can't get my head around that. I never will. I'll never be able to cope with that properly, I think. But yeah, he didn't make it. He just
Yeah,
didn't.
well, that's a measure of the amount of pressure in that environment.
Right.
And another reason to give yourself credit that was the magnitude of the pressure that was going on, and you survived it. And not only that, you've made a remarkable life for yourself. I mean, and giving yourself full legitimate credit for that is a foundation for then being able to say, you know what, I have emotions around this move to Washington and they deserve to be heard.
Good advice. Excellent advice. I agree.
Do you have any questions for me before we close? This has been remarkably insightful.
2,000 or 3,000, so I don't think you quite have time. I'm trying to figure out how to implement all the things that I'm reading, and I'm finding it very difficult. Everything I'm reading makes sense, the brain and the pain and all of that. But now what do I do? Okay, now that I'm aware, what do I do? And that's really where I'm at right now.
Okay. Well, what I would do, maybe the first place to start is to write down how you feel about moving to a place that has only a fraction of the emotional support that you got in Kansas City.
Okay.
Because, you fought your way out of an environment that had no emotional support. So that is incredibly important to you, is to have that, being surrounded by people who know you and love you and care about you. And because we all need that, but it's especially important for somebody that didn't have it growing up. And to have it suddenly removed at your age, I think is more than capable of manifesting physically.
Okay.
So I would write down all the thoughts and feelings you have about this just to get them out there in words on a piece of paper, and as much of the emotions as you can. And remembering that there's going to be a part of you that says, oh, I can't write this because that's going to hurt somebody's feelings, because that's who you are.
Yeah.
But this is the time, you don't necessarily have to show this to anybody. So
Right.
that means you're not going to hurt anybody's feelings just by putting it on a piece of paper. And if you hold back, then your feet won't get better.
Gotcha. I will be writing as soon as we are off this podcast.
All right, sir.
Thank you so much, Dr. Clark. It was a pleasure and a privilege to talk with you. And
Thank you.
really, really love what you're doing for all of us.
Much appreciated. And everybody who watches this is going to learn a lot. So I'm very grateful to you for sharing so much of your life with us.
My pleasure. Thank you very much.